The big headline will be the announcement that all American adults will now be eligible for a vaccine on April 19th. That is 2 weeks from today, and earlier than expected. The president will likely credit a better than expected rollout. More than 4 million Americans received shots on Saturday alone, and more than 167 million doses have been given out so far. That means the White House is on track to beat its goal of 200 million vaccine doses by the end of April. And while some parts of the country are seeing a spike in new cases, Dr. Fauci says he is hopeful the prevalence of vaccines and the speed with which they are being rolled out will prevent a surge if we continue to follow safety precautions.
As long as we keep vaccinating people efficiently and effectively, I don't think that's going to happen. That doesn't mean that we're not going to still seeing increases in cases. Whether it explodes into a real surge or not remains to be seen. I think that the vaccine is going to prevent that from happening.
Joining me now is NBC News Now correspondent Priscilla Thompson, who is in Lansing, Michigan, and the managing director of Opportunity Labs, Dr. Mario Ramirez. He served as pandemic and emerging threats coordinator at HHS during the Obama administration. And with a warning to both of you that if the president comes out, I will have to interrupt you. Let's get right into this. Priscilla, tell us what you can about what we're going to see.
Well, Katie, Michigan has been sort of leading the country for the past several weeks in terms of COVID-19 cases. And, you know, in recent days, they have seen some of their highest numbers since December in terms of new cases per day. And so you mentioned that President Biden is going to be speaking about expanding vaccine access. That is something that Michigan did just this week, allowing anyone over the age of 16 to receive that vaccine. And that is really important from what we're hearing from healthcare workers here at a hospital in Lansing, Sparrow Hospital here in Lansing, because the majority of patients that are filling their COVID beds and units right now are aged 18 to 49. People who prior to this week did not have access to that vaccine. And I asked doctors here about what exactly is driving the spread in that community. Take a listen to what one doctor shared with me.
Because younger people tend to move around more, maybe are a little bit less careful on average with their isolation, their distancing, their use of protective equipment, that they may therefore be more contagious before they become ill enough to be in the hospital or isolated at home. And that, I think, is part of what's making the spike, if you will, worse, along with the variants we're starting to see.
And the other big question here, of course, is will there be enough supply to meet this new demand? Folks here, we know that the White House is sending an additional 60,000 shots to Michigan this week. And so it will be interesting to hear what, if anything, the president has to say about that. Katie?
Priscilla, thank you. And Dr. Ramirez, what is your sense of where we are right now? We have this deluge of good news with a number of Americans that have been vaccinated, the guidelines from the CDC on vaccinated Americans being able to travel, also the guidelines about how it's not very common to get this virus from touching a surface. And then you also have the spikes like Priscilla was reporting on in Michigan. Where are we at the moment?
Sure. So we're seeing two competing trends, Katie. So the first is that case counts are increasing in about half of the states. But importantly, they seem like they're going up, particularly in younger folks, as was just discussed. You know, those people who are age 20 to age 50. The other trend that we're seeing, though, is that hospitalizations and cases are going down in those persons who are already vaccinated, those older Americans. And so that, you know, essentially tells us what we expected to see, right? We preferentially vaccinated older Americans first. And so case counts should be going down in that group. That tells us that the vaccines are working. Now, the third piece that we're seeing, and this is really what has folks concerned, is that the rate of increase or the acceleration of new cases in that younger age group seems to be picking up speed. And that's why we hear these mixed messages. That's why it feels a little convoluted. And so what I think the take-home message is that we need to try to get as many of those younger folks vaccinated now as well to help blunt this surge.
And you can see Joe Biden, the president, has now entered the vaccination site in Alexandria, Virginia. We're waiting for him to speak. We'll go there when he does. Dr. Ramirez, there's also talk about, and this is a scary sounding name, a double mutant variant. Is it as scary as the name sounds?
No, I don't think so, Katie, right? I mean, I think, this is part of the scientific process where we continue to discover and we continue to sequence these things, and there will be, many new variants in the future. What we know about this double mutant, right, is that it has two variations that we've seen in different parts of the world that are now combined in a single strain. But the vaccines that we have currently seem like they do work against each of those individual strains. And so there's good hope that it should work against this double mutant. And so I caution folks about getting, too excited or overly worked up when we say that there's a new strain we've discovered. What's really concerning is when we hear about people who are vaccinated who are then getting sick. That tells us that we have a problem, and we haven't seen that with this double mutant yet.
Got it. Dr. Mario Ramirez, thank you so much. And Priscilla Thompson there in Lansing, Michigan, where they're seeing a spike. Thank you.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.